Hello everyone, welcome again to my channel. I am Dr. Zina, a full-time dentist. Today we will be talking about the 4 parts of Kennedy classification. But before we continue, make sure to hit the subscribe button because it will really help me to do more and more videos. Now in Kennedy classification 1, it's 1 equal to 2. So there is bilateral loss in both sides of the posteriors. So this is a Kennedy classification 1. 1 means 2. Whereas in Kennedy classification 2, there is a unilateral loss. So 2 means 1. Now, if we have one tooth in the posterior, whether the first molar or second molar, and it does not cross the midline, meaning that there is no missing anterior teeth, so the classification will be class 3. Similar here, there is a bilateral loss, but we have second molar is there in both sides, so it means that it is class 3 Kennedy classification. And by the way, this is a Kennedy classification 3 modification 1 because we have one missing area and the other area basically is considered to be classification, not modification. Okay? Now, if the missing teeth cross the midline, meaning that there is a missing upper or lower anterior, so it is Kennedy classification number 4. Not only we have classification for Kennedy, we have also modification as well. Like in figure 5.5, you see that we have a bilateral loss. So bi means 2, 2 means 1. So it is Kennedy classification 1, and since we have only one missing area in the top, so it will be mod 1 or modification 1. Whereas for figure 5.6, we have a first molar is present. So this is Kennedy classification number 3. And since we have two missing areas, so it is Kennedy classification 3 modification 2. Now for the classification by support. For class 1, it is tooth supported, meaning that it is supported by abutment in order to hold the RPD. Whereas for a class 2, it is tissue supported. And also you can consider it as tooth supported because it is also, there is an abutment that is used to support the RPD. Whereas for class 3 and 4, it is tooth and tissue supported. So it is not only supported by the abutment, but it is also supported by the tissue as well in order to hold the RPD in place because it is a critical area, it is in the anteriors. Because it is due to the fact that we hold the food with our anteriors, so we need to, the RPD, it should be rigid enough in order to hold the teeth in place. So that's why for class 3 and 4, it is tooth and tissue supported by the abutment and by the tissue, which is the gingiva. Thank you all for watching my video. If you enjoyed, don't forget to hit the like button, comment down below if you have any questions, and subscribe for more videos.